What should I expect from a lymphoma lymph node biopsy? Getting ready for a lymphoma lymph node biopsy can feel a bit overwhelming, but knowing what to expect can help ease your mind. This procedure is a key step in diagnosing or evaluating lymphoma, including non-Hodgkin lymphoma. It involves removing all or part of a lymph node so a pathologist can look at the tissue under a microscope. This helps identify if lymphoma cells are present and determines the specific type, which is crucial for planning treatment. Before the biopsy, your healthcare provider will explain why it's needed and go over the procedure details. They will review your medical history and medications to make sure everything is safe. Most biopsies are done as outpatient procedures, meaning you can go home the same day. The type of biopsy performed depends on the location and size of the lymph node. The most common is the excisional biopsy, where a small incision is made to remove the entire lymph node. This method is often preferred because it preserves the tissue structure, allowing for a thorough examination. Sometimes, if the whole node cannot be taken, an incisional biopsy is performed, removing just a part of it. A core needle biopsy uses a larger needle to extract a core of tissue, providing more information than a fine needle aspiration, which only collects cells and is rarely used for initial lymphoma diagnosis. During the procedure, local anesthesia is usually used to numb the area, so you should not feel pain. If the lymph node is deep inside the body, your doctor might use sedation or general anesthesia. Imaging methods like ultrasound or CORT scans often guide the needle or surgeon to the right spot, especially for hard-to-reach nodes. You might feel a quick prick from the anesthesia and some pulling or pressure as the tissue is removed. The entire process typically lasts less than an hour. Afterward, a dressing will be placed over the site. You might experience some mild discomfort or pain as the anesthesia wears off, which can be managed with over-the-counter pain relievers like paracetamol or ibuprofen. It's important to keep the area clean and dry for a couple of days to prevent infection. You may notice some swelling or bruising, which usually resolves quickly. The tissue sample is sent to a laboratory where a pathologist performs detailed tests. These include microscopic examination to look for abnormal cells, immunophenotyping to identify specific cell markers, and genetic tests like fluorescence in situ hybridization to detect genetic changes. These results help classify the lymphoma subtype and guide treatment options. Results usually take about 7 to 10 days. Waiting for results can be nerve-wracking, but support from friends, family, or your healthcare team can help you through this time. In summary, expect a safe, relatively quick procedure with local or sometimes general anesthesia, minor discomfort afterward, and a waiting period for detailed lab results. Always follow your healthcare provider's instructions before and after the biopsy, and don't hesitate to ask questions or express concerns. Remember, each person's experience can vary, and your medical team is there to support you through every step of this important diagnostic process.